Hello everybody, welcome to MKJ Pharma classes. In today's video, we are going to discuss about classification of anti-TB drugs. Before I start this video, I request you to kindly subscribe to MKJ Pharma classes channel and also hit the bell icon to get the regular notifications. So before we start with classification of anti-TB drugs, we will see what is TB, how it is caused, and then we will discuss the drugs which are used in TB. So tuberculosis or TB, it is a chronic granulomatous disease, which means it is an immunodeficiency disease. So TB is basically a disease which is caused by Mycobacterium tuberculosis. So because this Mycobacterium tuberculosis, they weakens the immunity. As a result, the patient will be suffering from various kind of infections caused by various bacteria and fungi. So basically patients are susceptible to attack of bacteria and fungi. Now it is called granulomatous because there is a formation of granuloma. Now granuloma, it is a mass of immune cells which is formed at the site of infection or inflammation. Therefore, it is called as granulomatous disease. Anti-TB drugs, they are classified into two broad categories according to their utility. These are first line drugs and second line drugs. So in the first line drugs, we are having drugs which are highly effective and least toxic. Whereas in second line drugs, the drugs are less effective and highly toxic. So the drugs which fall under first line drugs are isoniazid, rifampicin or rifampin, pyrazinamide, ethambutol and streptomycin. Then in second line drugs, we are having drugs like ethionamide, prothionamide, cycloserine, terizidine, para-aminosalicylic acid, rifabutin, thioacetazole. Then in second line drugs, we also have drugs like fluoroquinolones, which include ofloxacin, levofloxacin, moxifloxacin and ciprofloxacin. Then there are injectable drugs which are used as second line drugs. These are kanamycin, amikacin and capreomycin. Now for each drugs, we are having standard symbols or standard alphabets which are used to denote these drugs. Like for isoniazid, the symbol is H. Now it is easy to remember because if you write I and you just invert it or rotate it, then it becomes H, right? So isoniazid is related to H. Simple to remember. Rifampicin R, just the starting letter. Pyrazinamide, the symbol used is Z. Now again it is simple to remember because this is the only drug where Z is there in the spelling. So pyrazinamide is Z. Ethambutol E and streptomycin S. Similarly, for ethionamide, we use ETO. For prothionamide, PTO, that is PTO. Cycloserine, CS. Terizidone, that is TRD. Para-aminosalicylic acid, that is PAS. For rifabutin, we do not have anything. Then thioacetazone, that is THZ. Then for fluoroquinolones like ofloxacin, we have OFX. Levofloxacin, LVX or LFX. Moxifloxacin, MFX. And ciprofloxacin, CFX. Then for kanamycin, KM, amikacin, AM, and capreomycin, CM. So all these symbols are very easy to remember. Anti-TB drugs, they can also be alternatively grouped in 4 different groups. That is group 1, group 2, group 3, group 4 and group 5. So in group 1, we have drugs which are first line oral anti-TB drugs. So first line oral anti-TB drugs are just 4, that is isoniazid, rifampicin, pyrazinamide and ethambutol. Now remember, in your first line drug we also have streptomycin, but it is not used orally. It is used in the form of injection. So it falls under group 2. So group 2 includes injectable anti-TB drugs. So which includes streptomycin, which is the only first line drugs. Then other drugs are all second line drugs. That is kanamycin, amikacin and capreomycin. Then group 3 includes fluoroquinolones. So the drugs are ofloxacin, levofloxacin, moxifloxacin and ciprofloxacin. Group 4 will include again oral anti-TB drugs but second line. So group 4 is second line oral anti-TB drugs. This includes ethionamide, prothionamide, cycloserine, terrizidone, and para-aminosalicylic acid. And lastly, group 5 drugs. These are the drugs with unclear efficacy. That means the efficacy is doubtful, so they are not generally used. It is only used for in case of multi-drug resistant TB or extended drug resistant TB. So these drugs are thioacetazone, clarithromycin, clofazimine, linezolid, amoxicillin clavulanate, and imipenem or cilastatin. So these are the 4 different groups of drugs which falls under anti-TB drugs. Friends, if you like this video, then please click on the like button and do not forget to share with others. Thank you.